attending today. We are here to know some of safety features related to the coronavirus vaccine from our expert, Dr. Arul Vigg. This session will end at 4 p.m. If you have any question, please use the chat line. Do not make any noise. If you don't know how to use the chat line, we will have a verbal session at the end of the session if time allows. Now I'm going to introduce Dr. Harsarup Singh to say a few words regarding our organization and welcoming everybody. Thank you. Dr. Harsarup Singh?
डॉक्टर बोलिए, अनम्यूट करिए अपने आप को। डॉक्टर साहब अनम्यूट करिए।
हेलो।
हाँ, यस, वी कैन हियर यू। ओके।
Doctor, your turn.
He is trying to unmute himself. अनम्यूट, डॉक्टर साहब अनम्यूट करिए अपने को। He's not unmuted. Yeah, now okay.
Yes.
Go ahead.
Okay. In any situation, recognition of the problem is important, and in this case, the recognition did not come. It was available to the leadership, but the nation did not realize how bad the situation was. They were not educated properly. After recognition comes education. And this is what we would be benefiting from now. Dr. Vigg, who is an authority, will tell us about what the problems are and about the treatment and so on. I am very happy that Professor Banik ji made this possible. He arranged this, and we are thankful to him. The situation is very serious. Millions of people are dying. Some young ones are plugged before they have seen much of the world and have participated. It's very bad situation. In terms of money, that is a problem now. The new president has said that it would cost $2 trillion to handle the situation. I hope we find the money. We all ought to cooperate the very best as we can, because this curse does not spare anyone, young, old, middle-aged. So we have to be careful and follow the proper advice as best as we can. I don't want to take up any more time. As I said, Dr. Banik has been nice to arrange all of this, and I will now give the floor to the next speaker.
Dr. Banik?
Well, first, I'd like to echo the sentiment expressed by our distinguished senior advisor, Ambassador Harsarup Singh ji. Now, first, Madam President, thank you for giving the opportunity to introduce one of the prominent physicians in this country, Dr. Arul Vigg. He's board certified in both internal medicine and also in nephrology. He is currently the medical director of Wellspan Medical Group and associate professor of internal medicine of this prestigious Wellspan Medical Group in Pennsylvania. He has masters in healthcare. Let me touch a little bit of personal experience of mine. 11 months ago, when the coronavirus started, my physician of 50 years retired. I don't have anybody in this world to look for. By miracle, Dr. Arul Vigg came into my life and he saved me. I would have been dead by now if he would not have taken good care of me. He was the finest physician I have ever come across. He knows a lot about coronavirus pandemic because he was giving lectures all over. So it is my honor, pleasure, and delight to introduce to you one of the legendary physicians of my life, Dr. Arul Vigg.
Dr. Banik, thank you so much for the kind words. I'm not sure if I'm deserving of any of the praise that you're giving me, but thank you so much. Harswarup ji, thank you so much for the kind introduction as well. Yogendra Gupta ji, namaste. Everybody that I've gotten to know over the years. Sunil Singh ji, I hope you are here, and thank you for the opportunity today to speak with everybody. And give some advice, whatever little we know about this. I'm going to try to share a slide deck that I have made, and it says host disabled participating screen sharing. I'm assuming Nanaji, is it possible for you to disable the screen sharing by any chance?
I think I will try to do that.
I have a slide deck that I would love to go over with everybody. Yep, it is letting me do it. Thank you, Yogendra Gupta ji.
You got it? Okay.
Now, I hope can you guys see my screen?
Yes.
Yes.
Yes, we can see it.
So let me put this in slide deck mode. Is this visible to everybody?
If you want to add something, but keep your
Yes,
All
we
right.
can see it, Dr. Vigg.
Yes.
Perfect. Perfect. So let me start with a little introduction about COVID-19. I can hear a lot of voices in the background. I'm not sure. Nanaji, if you could ask everybody to mute that perfect. Thank you. So let me give you a small introduction about the COVID-19. As everybody knows, it's in coronavirus known as the severe acute respiratory syndrome, Corona 2, that's the SARS-CoV-2, which we think came from Wuhan, a city in the Hubei province in China. We're all aware of this. It rapidly spread, resulting in this global pandemic, which we're all a part of. And February 2020, the World Health Organization named the disease COVID-19. You know, we all call it COVID-19, which stands for Coronavirus Disease 2019. The 19 is for 2019. That's where COVID-19 comes from. Since then, we've been, one of the biggest goals that we've had in medicine is to get vaccines to prevent this infection, and have been vigorously pursued. As of January 2021, several vaccines have become available. We studied about 40 candidate vaccines in human trials, and over 150 in preclinical trials. Finally, late of 2022 got approved, and a third one, as we're all aware, by Johnson & Johnson, is awaiting final approval, which should be coming out shortly as well. This is today's numbers, the latest numbers as of 12:30 this afternoon. Worldwide, we're at 96.2 million, 2.06 million deaths. United States, we've had 24.9 million cases and 414,000 deaths in the United States as of this afternoon. Just a brief kind of overview of what are the symptoms of COVID-19. As we all know, cough, shortness of breath, difficulty breathing, fevers or chills, muscle or body aches, vomiting or diarrhea, and this classic one that we're all aware of, loss of taste or smell. Symptoms can range from mild to severe disease and appear 2 to 14 days after you have been exposed. So you could still be asymptomatic for up to 48 hours prior to showing symptoms of the disease. When should someone seek medical care? Immediately, when you have trouble breathing, persistent pain, pressure in your chest, new confusion, any mental status change, inability to wake up or stay awake, and obviously bluish lips or face, that means you're hypoxic and decreased oxygenation is in your system. That's when we say seek emergency care. And I'll go over some more in the next slide. Why is COVID so dangerous? COVID is airborne. So there's a difference between being airborne and having a droplet transmission, which is what your flu is. Droplet usually is about, you get the transmission when there's coughing and sneezing and can spread via the droplets of saliva and mucus. Airborne are tiny particles that are less than 5 microns in size, possibly produced by or coughing, and these get suspended in the air for a longer period of time and can travel further. Just for comparison, a human hair is about 60 to 120 microns. COVID is less than 5 microns in size, and it can remain suspended in the air for a much longer time. That's why it's much more dangerous and spreads much more rapidly and faster. Things you can do to manage your COVID symptoms at home. Obviously, try to stay home if you can, away from places. Monitor those symptoms I just told you about. Get rest and stay hydrated. If you have a healthcare provider, talk with them and notify 911 when you have those emergency chest pain, blue lips, shortness of breath, and those emergency symptoms. You need to get 911 and help. Obviously, cover your cough and sneezes. Wash your hands often. Stay in a specific room and away from other people. Quarantine yourself so you're not spreading this virus to your loved ones. Avoid sharing personal items. All the surfaces that are often getting touched. We have Lysol, we have any disinfectant, bleach, for example, that can clean your countertops and tabletops. So those are the simple things you can do at home to prevent this from spreading. This is a screening flow chart. It may be a little bit too complex. I'm sorry, it's a little bit of a busy slide, but what are we doing when we are suspecting any students or any healthcare workers who have symptoms of infectious disease? And, we send them for testing. But again, like I said, it takes 24 to 48 hours before you even show symptoms. But the CDC has specific ways how we quarantine and how we screen people for COVID-19. And I'll give you the link. It's right here, cdc.gov/coronavirus. And this is the flow chart of the screen that we're using in hospitals. What are the diagnostic tests? In brief, we have the NAT testing, then we have the serology antibody testing, and then you have the antigen testing. The NAT testing, which is the RT-PCR, which is a polymerase chain reaction that we do use. This is the primary clinical use that we're using a lot of for the current infection. It's a nasal swab. It has a very high sensitivity and a very high specificity. And the time to perform the test ranges from about 15 minutes to 8 hours. You should be positive for it. So this is the gold standard, which is the NAT PCR test that we use. Now they're developing assays that you can get them mailed over to your house as well. And it starts to get positive about 8 hours or so. There is some false negative rates. They're saying it's from about 5% to 40%, depending on the test that you use, but this is the most specific one. Antibody detection, which is from your blood. This is very variable. What we're checking for is the IgG, and this takes about 14 days after the onset of symptoms for you to be positive for it. So this takes a little bit longer, but this can be a little bit faster. Lastly, antigen testing. These are less sensitive than the NAT testing or the nucleic acid testing, and they usually get positive about 5 to 7 days after the onset of symptoms. So if anything you want to remember from this slide, it is your NAT testing that is going to have a very high specificity and your sensitivity if you're doing the nasal swab. Serology takes about 14 days, 2 weeks for it to be positive. So that's diagnostic testing in a nutshell. These are CT scans for some of our patients that we have seen so far in the hospital. I don't want to give too much information and confuse anybody, but this is the fluffy appearance or the consolidation. That's the clinical word that we use within the lobules of the lungs, and that's how it starts to look as the disease progresses in the lungs from here, and all the way it becomes hazy all the way to the bottom. So this is the consolidation, classical consolidation on the CT scan called the ground glass opacification that we see on COVID-19 disease patients. Just a snapshot of our patients. When do you refer to the hospital? Again, like I said, one or more of the following features: severe dyspnea, dyspnea at rest, interfering with the ability to speak. When we say oxygen saturations, which we've all been giving patients, is these pulse oximeters. And if you start to see that your oxygen saturations on room air is less than 90%, regardless of your shortness of breath, we do recommend that they go to the emergency room. Obviously, if you're severely short of breath and you're not able to speak and you have blue lips, then you should be going to the hospital. And the third important thing, which we kind of said, altered mental status. If they're confused or difficult in arousing, then it's better to go to the hospital. But the number that I would remember is the oxygen saturation less than 90%. It would be ideal to be in a hospital setting and then get a CT scan, get the NAT testing done, and I'm going to talk about treatment in a little bit as well. Good segue to the treatment. Very, very controversial. We can talk about a lot of different things. The one thing we know that has a little data for efficacy is the monoclonal antibody treatment. It is now being evaluated in the outpatient setting as well. The FDA has issued an emergency authorization for a new medicine. It's called bemarituzumab. Again, even I have difficulty pronouncing some of these names. But we just had an emergency authorization for mild to moderate illness, and we can use this for those diseases. There's a lot of talk, there's a lot of data that still needs to be looked at about steroids. We've all heard about remdesivir. We've all heard about convalescent plasma. They all work. They all seem to at least decrease the length of stay. We're not sure if it can treat the disease, but we have noticed that patients are able to get off ventilators. They're able to recover faster when we have given a cocktail of the steroids, the remdesivir, and the convalescent plasma along with that. So there is some benefit of that. And then again, a little bit about plasma. We are encouraging all eligible patients to donate convalescent plasma after recovery from COVID-19. And you got to meet the FDA guidelines to be able to be a blood donor for the plasma. The other thing which has worked, and again, this is all off-label. There is no randomized controlled trials, or there is no randomized data to show that breathing exercises. There is some talk about steam inhalation that people have used. The thought process behind that is thermal inactivation, SARS-CoV-2 with steam inhalation. This is again all off-label. There is no randomized controlled trial or data to prove the efficacy, but steam inhalation seems to be inactivating the SARS-CoV-2 virus as well. Other things that we do off-label: pursed lip breathing exercises, sitting upright. Again, this goes back to our old, maybe the old Indian way of pranayama that we used to do, breathing exercises, deep breathing exercises, reclining in a bed or a sofa, placing your hand on your belly and the other hand on your chest, almost doing a chest percussion, if you will, to help with the breathing and to clear the mucus, seems to be helping a few of these people. Again, all off-label, no randomized control data to prove this, but it seems to be helping people. So let's now segue into the most important thing, which is the vaccine and how the vaccine works. So simple schematic, this is the COVID-19, and we've all seen this picture with its different spikes. What we have done for many, many years, for most of the viruses, we've taken genes of the spike protein on the surface of the COVID-19, and we've used a harmless virus as a vector that's going to hold part of that protein, inactivates that protein particle, becomes the vaccine that we administer at a lower dose, and then that's given to the patients. That's kind of the schematic of what the vaccine actually is. It's a component or a portion of the spike protein on the surface of COVID-19. Let me go back. So what that does is that spike protein, once it's injected into our body has different types of cells, namely the memory T lymphocyte cells and your B lymphocyte cells that remember, or they have the ability to say, okay, I saw this spike protein that was injected to me in a vaccine format. And then if you do get infected by the COVID-19, you have these memory cells waiting and ready to fight the COVID-19 if you should get that. So the vaccine is not a treatment, but it's basically immunity that you're making with that spike protein that helps you fight the illness much better. It takes your body a few weeks to produce these T lymphocytes and B lymphocytes after vaccination. So it's not going to be where you just go in, get the vaccine, and the next day you're going to have immunity against COVID. Therefore, you could be infected with the virus that causes COVID-19 just before or after the vaccination, and you can get sick with it. So it doesn't mean you get the shot and you're immune to it. That's the point I'm trying to make with this slide. You can have symptoms, and we'll go over the side effects of the vaccine as well, such as fever, redness, localized pain and swelling at the site of the vaccine. And those are things that can happen. This is normal, and these are signs that your body is building immunity against COVID-19. So let's talk a little bit more about the three types of main COVID-19 vaccines that are being worked on in the United States. I'm sorry. None of these vaccines can give you COVID-19. That's the disclaimer here. The first thing we'll talk about is the mRNA vaccine, which contains material from the virus that causes COVID-19 and gives our cells instructions for how to make harmless proteins, which I showed you the picture of that. After our cells make copies of the protein, they then destroy the genetic material from the vaccine. And then we talk about the T lymphocytes and the B lymphocytes, which become your memory cells and fight it. The other type of vaccine that has been worked on is the protein subunit vaccine, which is nothing but harmless pieces of protein of the virus instead of the entire germ, and they're still working on that. And then the third one, which is the Russian vaccine, is the vector vaccine, and I'll show you pictures of that as well. This contains a weakened version of the live virus. So this actually is the live virus that has genetic material from the virus that can cause COVID-19 inserted into it, and it's called a viral vector. And this kind of works in the same way and activates your T lymphocytes and your B lymphocytes, and that's how you fight the virus. So a good kind of slide about the different types and how they compare. We've seen the Oxford University AstraZeneca vaccine. I believe, again, don't quote me on this, I think this is the one that's getting available in India now. This is a viral vector where you have the genetically modified virus in it, 2 doses of that, and it's only about 62 to 90% effective. And this can be stored at a regular fridge temperature. Vaccine which we have are the two that have been approved, which is the Pfizer or the biotech vaccine and the Moderna. Both of these are the RNA, where I just showed you the part of the spike protein that we have used. We have 2 doses of that and 95% efficacy. And these two have been approved in the United States. The difference, as we all know, with the Pfizer biotech vaccine, it has to be stored at -70 degrees centigrade. So storage is a problem. Whereas the Moderna can be stored at about 20 degrees centigrade, and Moderna can be stored for about 6 months. Pfizer, I believe, has an expiry date of about a month or 2, not as much as the Moderna. And then there's the Sputnik V, again, a viral vector. This is the Russian vaccine, 2 doses and 92% only efficacy. And this can be stored in a regular temperature in a dry form. This is what they're using in Russia. This, I believe, is in India, and these 2 are the United States. Why cold storage? This is a common question our patients are asking. Why do we need to store these vaccines at such a low temperature? Because the mRNA, which is incredibly fragile, incredibly fragile, can get broken down very rapidly, and hence needs to be stored at that -70-degree temperature. It's that spike protein that's very fragile. So that's why it needs that low temperature for storage. The next little segment we can talk about is who is currently getting vaccinated and when. So it's been divided into 1A, 1B, and 1C. 1A was all the healthcare workers, approximately 21 million people. Long-term care residents or nursing home residents, about 3 million of them. 1B, individuals above the age of 75 or older, roughly the United States, 19 million of these people. Then the frontline essential workers, first responders, teachers, manufacturing people, postal service, public transportation, grocery store, there are about 30 million of those. We have completed 1A as of recently. Now we're at the 1B, where this big chunk, roughly about 49, 50 million people are starting to get their vaccines. And then is the 1C, individuals around the age of 65 to 74, roughly 28 million, and then 16 to 14-year-old people with high-risk conditions, 81 million of those, and then other essential workers, transportation, food service, energy, IT, media, and those people. And then it's going to be 2, which is less than 86 million people between the age of 16 to 64. They're the ones who are going to go last in the vaccination schedule. This is from the COVID-19 vaccine group that the data came out. What to expect after getting a vaccine? So I've divided this into 2. Locally on the arm, when you get the shot, expect to have a little bit of pain, some swelling, some redness along with that as well. Systemically, fevers, chills, fatigue, myalgias, and headache is expected after the vaccine. What do you do to reduce the pain and discomfort where you got the shot? Apply a clean cloth or a wet washcloth over the area. Use and exercise your arm, so you're increasing the blood flow, increasing the circulation to the area. Tylenol and any other mild painkillers also will help. In most cases, discomfort from fever or pain is normal. When should you contact your healthcare provider? If the redness or tenderness where you got the shot increases after a 1 to 2 day period, then definitely call your doctor. If your side effects are worrying you and they don't seem to be going away after a few days, then I would definitely call your healthcare provider. It should subside. I mean, I got my own shot and I had my personal experience, 24 hours. It is going to be red, it is going to be tender, and it does get better. If it doesn't get better after a day or 2, then you should call your primary care provider. Again, it feels like the flu. You should be able to do your daily activities, and it should all get better in a few days. Even though if you do have the side effects, you should get your second shot unless your provider tells you not to. Like I said, it takes time for your body to build protection after vaccination. Requires 2 shots. And then, even after you get the shots, still please follow your CDC guidelines. Cover your mouth and nose with a mask. Stay at least 6 feet away from others. Avoid crowds and wash your hands often. I'll go over some of these things in the slides ahead. A couple things we get asked a lot. Fact versus fiction. Vaccine is not going to give you COVID-19. It will not cause you to test positive for COVID-19. People who have gotten sick with COVID still have benefit from getting vaccinated as well. So if you have tested positive, and a couple down, I'm going to show you when you get the vaccine, even if you have been diagnosed with COVID-19, there is still benefit of getting the vaccine despite of being sick with COVID. Getting vaccinated help prevent getting sick with COVID-19. The other question some people have asked us in the clinic is getting the mRNA vaccine. It's not going to alter your DNA. It's not going to genetically modify you into Spider-Man tomorrow. So you'll still be able to function normally. It's not going to affect your DNA any which way. A snapshot of the Pfizer vaccine. That's the code name for the Pfizer vaccine. It's mRNA. We said 2 shots, 21 days apart. Usually it's in the upper arm, in your deltoid muscle. Does not contain egg or preservatives or latex. Moderna, again, it's an mRNA, 2 shots, 28 days apart. Does not contain egg, preservatives, or either. I'm going to go over a few questions that we get asked a lot about. One of the common questions at the clinic we get, is it dangerous to receive the vaccine if I'm COVID positive at the time I get vaccinated? What if I'm asymptomatic and I don't realize that I have COVID-19? So the data for that is there is no health or safety risk related to receiving the COVID-19 vaccine while you are COVID positive. Would I give you the vaccine if I know you're COVID positive? Probably not. But if you didn't realize you are COVID positive and you took the vaccine, you should be okay. The recommendation that we're saying is if you know you're COVID positive infection, and you should wait to get the vaccine until you recover from the acute illness. If a person is asymptomatic and unknowingly, like we said, gets vaccinated, there is no danger to your safety. And if you were treated with antibody treatment or convalescent plasma, we say you should wait about 90 days after your treatment before receiving the vaccine. So wait for 3 months and then get the vaccine. If someone tested positive for COVID-19, do they still need to be vaccinated? Yes. The long and short of it is yes, you should. But like I said, you should wait until your acute illness, and then you should get the vaccine. If you have allergies, what's the recommendation? If you have a food allergy, such as allergy to nuts or eggs, fairly safe to get the vaccine. Always carry the EpiPen with you in case of having allergies with vaccination before. It's safer to have the EpiPen. And if you have an allergic reaction, obviously, kind of the rule of thumb, please talk to your primary care physician before you get the vaccine. What if you're immunocompromised? If you have HIV, or you're going through chemotherapy, or you're going through radiation for a malignancy? Currently, we don't have data, but the long and short of this is yes, even if you are immunocompromised, it is fairly safe to get the vaccine. But we don't have the data so far to say emphatically yes or no, whether you should or shouldn't get it, but we are advising immunocompromised patients also vaccine if possible. Should pregnant or breastfeeding women receive the vaccine? So this is a loaded question. I tried to look at the ACOG, which is the American College of Obstetrics and Gynecology, as well as the Society for Fetal and Maternal Medicine. They are recommending pregnant and lactating women to get the vaccine if they have access to it, although it has not been tested in pregnant or lactating women. But the recommendation from the societies are, yes, you should get the vaccine if you have access to it. But there is no safety data that has still not been tested in pregnant or lactating women. After I receive the vaccine, do I still need to wear a mask? I get that question every day. Should I practice social distancing? The long and short of that is yes, absolutely. The reason for that, again, is the same thing. The protective effect of the vaccine is not immediate. You still require the 2 doses, and it will take months for enough doses to be made available for most of the community and the people, for everybody to get the herd immunity, for everybody to get the immunity against this disease. So the answer is yes, you should still be practicing social distancing and still be wearing a mask. Continue with hand hygiene, social distancing, so you can effectively fight this pandemic. Will you need the vaccine every year? That's another question that I get asked in the clinic. No current recommendations regarding the frequency. Everybody who participated in the clinical trials over the summer of 2020, we are actively still following them. There's still clinical data, and they're enrolled in programs for the next 2 years to determine how long the vaccine is going to be effective, and recommendations should be coming. When do you repeat the booster dose, or do you need to get this vaccine every year to sustain the immunity? Current research data is telling us that about a week after receiving the second dose, a person is about 95% protected from getting the COVID-19 disease. So roughly 1 to 2 weeks, 95% protection against COVID-19. What is the difference between the Pfizer and Moderna? I showed you the slide. Two different pharmaceutical companies. No vaccine is going to be 100%. Roughly, we say about 90 to 95. Both require 2 doses. Both work with the same mRNA technology. And both these vaccines are not interchangeable. So you cannot get one shot of the Pfizer and then take the second shot of the Moderna. They cannot be mixed. So if you take the Pfizer, please take the Pfizer second shot, or if you take the Moderna, then please get the second of the Moderna. Bottom line, you should complete your vaccination series with the same product that was given to you initially. Another common question in the clinic, should we be worried how quickly this vaccine was created? It was called Operation Warp Speed. Although it was warp speed, these are very, very safe, very, very effective vaccines. The answer is no. Do not be worried about the quickness or how fast this vaccine was created. The US government actually has focused all the efforts and attentions on creating a safe COVID-19 vaccine. This meant less barriers, more hands on deck. More funding was given to this project. To develop both these vaccines. Again, I am not a very good politician. I don't know much about politics. There are other people who know more about politics than I do here, and they'll give you their opinion on this, but it was a very safely created vaccine. It was done fast, but there is enough data to show the efficacy of both these vaccines. One last question, what does this COVID-19 variant mean? We're getting a lot of this in the news now. The variant is nothing but a mutation or a change that causes a virus to behave differently. It's the same COVID-19, but it's become more infectious. A variant doesn't change the disease that is caused by the virus. In this case, the variant doesn't change the COVID-19 disease itself. It changes how easily this COVID-19 can be transmitted and how easily people can get this vaccine. This is not a new virus. It is one of the many forms of the COVID-19. And it is very normal for viruses to evolve and change as they spread through a population, and COVID-19 is not an exception. So the variant is not a new virus. It's the same COVID-19. It's just spreading faster and it's more contagious because the virus also is learning to spread as we are learning to try to kill it with the vaccine. Is it more contagious? Yes. Early evidence is showing that it is more contagious and the disease can be more severe, but the vaccine seems to protect people against even the more contagious variant of the vaccine. First case of this variant was confirmed in Colorado on December 29, 2020. So that's what we're getting in the news. Bottom line for everybody, please get vaccinated. That's one of the small things we can all do to protect ourselves and others from COVID-19. Protection is obviously critically, extremely important. Can cause severe illness and death. We're seeing a lot of it in our hospitals and everywhere. Stopping this pandemic is going to require using an all hands on deck approach. Everybody's involvement is crucial. Everybody getting their vaccine, following hand hygiene, following social distancing, doing all the things we talk about in the news, and what I just showed you is extremely critical. Vaccines will work with your immune system, so your body is ready to fight the virus if you're exposed to it. Other steps like masking, social distancing help reduce your chances of being exposed to the virus or spreading it to the others. Together, the COVID vaccination and following the CDC's recommendation offers the best protection so far from the dangerous COVID-19 disease. Thank you. Thank you, everybody, for your attention. Sorry if I spoke too fast, but that's in a nutshell for everybody. Questions, concerns, I'm happy to take anything you guys have for me.
Thank you, Dr. Vigg. I have some question in chat box. Before we go to the individual people by raising their hands, I would like to read these for you to answer.
Sure.
Very first question came from Ashish. He has asked a question. Does the first and second dose of the vaccine should be have from the same manufacturer? You answered it in your talk,
Yes.
but
Yes.
I surely did. Yes. No
but you can provide a reason.
cross linkage. No cross linkage. Yes, sir.
Divya has a question. Divya Gupta has a question. She's asking one question, that there have been a few vaccine-related deaths reported. Is that true?
There has been, but we have looked at the numbers, the N, whenever we look at a statistical analysis and we look at the N, which is the total number of deaths, is very, very minimal. There was some data about those deaths that were expressed, but they were more from cardiovascular diseases rather than it being from the vaccine per se. Again, in the presentation, I talked a little bit about anaphylaxis.
Yes.
A little bit about the side effects. I talked a little bit about if you have issues like that, it would be a good idea to keep the EpiPen with you and prevent anaphylaxis against the vaccine, which can happen, although it's very, very low. The number, the N is very, very low. I hope that answers that question for Ms. Gupta.
Okay, now other question from Prabhashankar Singh ji. If a person had corona, does she still need to get the vaccine? I think you answered that.
That is correct. It was in the presentation. Yes.
It was in the presentation. I saw that.
Unless if you're in the acute phase of the disease or the illness, then the answer is you have to wait until the acute illness goes away, and then you should take the vaccine.
So can you tell something about acute sickness means what?
Yes, acute sickness is meaning shortness of breath, cough, fever. You're experiencing myalgias, those symptoms that I showed initially. When you need to go to the emergency room, your oxygen saturations are less than 19%. The answer is it's advisable to try not to take the vaccine at that point of time. Once you're over acute hump, then yes, you should take the vaccine.
Mr. Surya Prasad ji has a question. I think this is a very good question. Does diabetes interfere with the vaccine?
No. If you're diabetic or even if you're immunocompromised, the answer is yes, you should take the vaccine.
Okay, let me see what else I have.
Okay, there is one more question from Nana ji. She said that she has already taken the first shot and she wanted to know, will the second shot will give a headache or fever?
Yes, it can. The second shot, so let me explain a little bit. I should have said something in my talk. The first shot has a very low potency of the mRNA. The second shot is a much larger dose or a much larger potency of that mRNA. So you are going to be a little bit sicker with the second shot than the first shot. Yes, it can give you worse myalgia, can give you worse headache, can give you worse swelling and erythema on your shoulder and your arm where it's injected, but that should still not stop you from getting the second shot, especially if you have not had any major side effects with the first shot. Does
Thank you.
that answer that question?
That's all I
Nanaji?
have in chat box. Now, floor is open. Please raise your hand first before Dr. Vic can take your question. Yes, Pandey, Dr. Ramesh Pandey, please. Unmute yourself. Unmute yourself. We can't hear you. Unmute yourself. While he's unmuting himself, anybody else has any question, please raise your hand.
Can you hear me?
Yes, I can hear. We can hear you.
Good.
Yes,
First,
please. Go ahead.
first, I would like to compliment. He did a good job. Is it possible to get a copy of what he presented today?
I'm going to have to charge you. No, I can definitely send the presentation. Absolutely. I'll send it to Nainaji and she'll disseminate the information to everybody. Absolutely.
You have done a wonderful job in explaining everything, and I really appreciate. I'm calling you from New Jersey, and
you.
I used to be in Maryland area, and these guys were kind enough, and I brought the first drug to treat sickle cell anemia. So first Ayurvedic drug to treat sickle cell anemia. So that's why your work is very, very important to me.
Thank you so much, sir. You're very kind. You're extremely kind.
Anybody else? Dara Banik has a question. Dara Banik, unmute yourself.
Okay. First, Dr. Vigg, on behalf of NCAIA, all the members, I want to express my deepest appreciation for your brilliant presentation with slides and giving all the information that we need in these pandemic conditions. So we are very proud of you that you are member of NCAIA, member at large. And we would like to see that what you presented today disseminated to all the members, all the people who attended this, your presentation this afternoon. So on behalf of President Narendra Desai, Chairman Sunil Singh, our Vice Chairman, Dr. Jigendra Gupta, and rest of the people, I want to thank you again for taking time off to educate us about this pandemic and various aspects of the coronavirus and vaccine. Thank you, thank you, thank you.
Oh, Dr. Banik, thank you.
Dr. Vigg, I echo what Dara said, but there are some people still having questions. Yes, I will take you. But I think it's very, very concise, exhaustive, and very educational. I think we got everything what we need to know about COVID-19 vaccine, actually. COVID-19, we know that for 1 year now, almost. What is that? How we can quarantine. But today, we got really inside out of the vaccine because there are many concerned people are still scared to take this vaccine, including myself, because I'm diabetic. So very good presentation, very concise, and I hope everybody has enjoyed the talk. It was clear and crisp, and there was no doubt about clarity. So it was not fast, Dr. Vigg. It was okay, step by step. We are trying to learn what's going on, step 1, step 2, and then step 9. And I think Ashish had a question. Just please.
Yes. Yes.
I have a question.
Sir.
I have plans to take the shingles vaccine.
Mm-hmm.
How long should I wait after the 2 doses of COVID vaccines are taken?
That's a good question. So shingles vaccine, you should at least wait. Do you need the vaccine immediately? Is that what have you already taken it, or are you planning to take it?
No, I was planning to take, but I want to take COVID vaccine first because I am more than 75 years old, and after COVID vaccines, I was just thinking how long I should wait for the first dose of shingle vaccine? Because that also is 2 doses, single vaccine.
Correct. So I would first get the COVID vaccine if you have not gotten that already, and then I would wait for 90 days, 3 months, before I would get the shingles. Unless, again, I don't know your whole medical situation and you know your immunity and how immunocompromised or immunocompetent you are. But there is no unfortunately, there is no crystal clear guidelines to say, but the rule of thumb is 90 days, 3 months before you take any other vaccine, because we still don't know the cross reactivity between this particular vaccine and the shingles shot. For safety, I would say at least wait for 90 days, but again, talk with your primary care provider. That's kind of what we always would say. I'm not trying to give you a blanket statement. I would look at your whole medical picture and then make that final decision. But rule of thumb, 90 days, 3 months before you should take any other vaccine. That's just the rule of thumb, though.
But in any case,
There is another
should I
question
take
from-
COVID vaccines first, right?
Yes.
Okay.
Yes. The chances
Thank
of
you,
you,
sir. Thank you very much.
no, chances of you succumbing to shingles is much lower than you succumbing to COVID-19.
Right.
That would take
Dr. Vigg,
preference.
there is another question from Mr. Satish Gupta. Go ahead,
Sir.
Satish.
Sir.
Unmute yourself. We can't hear you. Unmute yourself. We can't hear you. Unmute.
So Gupta ji, I'll recommend to move to the next question. We have two questions. One is from Sunil ji and from Naina ji.
Okay, Nana, do you have a question? Nana, unmute yourself.
I am on mute. Can you hear me?
Yes, Nainaji.
Okay. No, I just wanted to say thank you, Dr. Vigg, for your valuable time and excellent session. And I also want to thank our team who is behind the scene, who has prepared all this to make it possible. And of course, our community who has joined today. I really thank everyone. Thank you.
Thank you, Nainaji.
Thank you.
Sunil ji.
It's not my question, but Dr. Renuka Mishra cannot call. I don't know why, but she said she has question that these vaccines are animal-based or plant-based?
Is the vaccine annual based or what was that?
Animal-based or plant-based?
Oh, animal-based or
Yeah.
plant-based?
Right.
I guess the definition for a virus, I'm assuming, would be an animal.
Well, the problem is she cannot take, there are some people who only can take plant-based.
Religious. I got you.
That's the reason she is asking.
Sunilji, I don't know the answer to that. I guess the definition for a virus.
Okay. Second, yeah, go ahead. Go ahead, Gupta ji, you were saying something?
Yeah, I was saying about animal and plant, and just now Sunil Singh ji mentioned that some people cannot take the animal vaccine. Is there any other way to treat this? I mean, I heard from Sunil Singh ji that some people may not take the animal vaccine.
Yeah. Well, I'm looking at it here simultaneously as I'm talking. There is a group of highly regarded vegan people who are, and I'm looking at it on my phone, plant-based doctors who have created a video, and it's called notnatural.com. I'll post the link on there as this question was posed. For vegans and vegetarian people, it's I think it says it is on the vegan side of things, but I'll post the link on here in the chat box. There's a discussion online about this, which I wasn't aware about, unfortunately, but that's a great question. Usually things don't stump me, but the vegan question stumped me.
Yes, they do come.
Thanks for that. And she has another question.
Thanks. Satish Gupta, are you ready?
Hold on, Gupta ji, let me finish. I want more question.
Yeah, okay.
Okay, Dr. Big, there's another question that she's saying she believes some company is making it some vaccine which you have to take only one time, not 2 times. It's some vaccine is coming, you have to take just one time and you don't have to go twice.
I think she's indicating to the Johnson and Johnson one, Sunil ji.
Okay.
It is not yet FDA approved. It is in the pipeline. It is a single dose. We do not have the data for that yet, Sunil ji.
Okay, thank you.
That is correct. It is in the pipeline. That is correct.
Dr. Vigg, this is Dr. Suman Vardhan. I congratulate you for your beautiful and very elaborate discussion. And
Thank you.
most of us not only enjoyed, but loved your presentation.
Thank you, Sumanji. Thank you so much. You're very kind.
Yogender ji,
Yeah.
Now
Yes,
let's,
sir.
yeah, go ahead, answer.
I have a question. I lost my picture here, but I'm glad you can hear me. Dr. Vigg said in his talk that there is no new strain, but it's just a worst case of COVID-19.
Variant.
I read in somewhere that in England they have a new strain. Is that a new strain or what you explained to us, a worst case of the existing strain?
It's the same variant of the COVID-19 that is more aggressive, Ruchi. Again, in medicine, we think we know there is the COVID-19. There's a lot of speculation. There may be a COVID-20, there may be a COVID-18, but so far there has been only one strain that has been identified and it has mutated. It has learned to live amongst us human beings and has become more virulent. It has become more potent. It has become more contagious. It's the same SARS coronavirus 19, but it has mutated. So we're still labeling it as COVID-19, but we're calling it a different variant. That is correct.
Thank you.
Satish Gupta, are you ready? Are you ready with your question?
Dr. Vigg, this is Dr. Pandey. I would
Sir.
like to just you in your slides when you were showing the Pfizer vaccine is it is neither animal nor plant, but it is a modified. It has no eggs and other things. That's what you told. And so I don't think it will be considered as an animal protein, animal vaccine or something like that. Am I right? Am I wrong?
I think you're partly right, but the problem is a lot of these vegan groups will not take a vaccine that was even tested in animals. Although the vaccine per se may not be an animal protein linked virus, but it depends on the extent of veganism we're talking about here.
Okay,
that makes sense?
Dr.
Thank
Vigg,
you, thank you, thank you.
I think Rajiv has to say something. Rajiv, you mentioned something in chat box. Can you talk to Dr. Vigg?
I'm sorry, was that for
You
me,
have
sir?
mentioned something in chat box, I think.
Yeah, sure. So that was a small note of thanks to Dr. Vigg. Dr. Vigg, let me congratulate you for such a terrific session, providing all the relevant information in one shot. Anyone can look for at this point of time, considering this is a coronavirus time and everybody is quite scared, both because of the virus as well as they're not sure whether should go for the vaccine or not. And considering that we have multiple choices, and frankly speaking, even I have no idea what Serum Institute vaccine is made of and what if Pfizer is made of. So I really found it very, very informative. At the same time, I have some friends at my home. They were very happy to attend this. They attended the whole session and they find it very top notch. So I couldn't thank you more. And your help at this time is massively appreciated. Thank you, doctor.
Thank you so much.
Dr. Vigg, I have a question. What
Yes.
is the youngest age that a child can take the vaccine safely?
So it has not been studied in children. We cannot endorse it below the age of 16. If you look at the presentation that I had made, The category 2, there's 1A, 1B, 1C, and then there's category 2. In the category 2, it starts from the age of 16 to 65. Below the age of 16, it has not been studied, ma'am. No.
So if there's no more question, can we adjourn the meeting?
Yes.
Everybody done?
Anybody
Sir,
has
can you
question?
hear?
Okay,
Can you
give a
hear me now?
Yes, we can hear you.
Okay, now just talk to the Satish Gupta. 1 minute.
Okay, go ahead.
Good evening, Dr. Ved. I have a
Sir.
question. Is there a under category 1B, is there a pre-qualification or anybody above 75, irrespective of their health, can have the vaccination?
So you're specifically asking about 1C or 1B?
1B above 75 or more,
Uh-huh.
is there a pre-qualification for the weight and blood level, hemoglobin, or anybody can just have it?
Mostly it is for anybody above the age of 75. That is correct.
Thank you.
No, that is. I'm asking about the medical conditions which which can prevent taking the dose.
Or which can prevent taking the dose. There is no contraindication if that's what you're asking. Unless you're allergic to the vaccine or if you've had allergies to the vaccine previously. That is correct.
Okay.
I'm sorry, I misunderstood your question.
No.
Thank you, Dr. Big.
Gupta,
Thank you.
And we have one last question. The friend at my home, he joined your session and enjoyed a lot. He has one. The last one.
Sure.
So over to Avinash.
Thank you, Dr. Vigg. It was a very nice presentation, very informative. I just have one quick question over here. After going through this presentation and learning, we know that the vaccines options that you have listed down, which are available, like AstraZeneca and Moderna, including Pfizer. I want to understand, like, the question which was raised just a couple of minutes back about the new trait which has emerged from Britain. Are these, you mentioned that this virus which has come up is just a variant. So are these vaccines, once you take it, are they having an efficacy to deal with the new trait as well?
The long and short of the answer to the question is yes.
I see.
It is efficacious even against the contagious variant. Yes.
I see. Thank you very much.
Now, again, we don't have long-term data. I would take it with a pinch of salt, where the CDC is telling us yes, but I don't have long-term data to validate that yes. So I would take that with a pinch of salt for sure.
Yeah, that is understandable. Yeah, thank you very much. I appreciate it.
No problem.
Dr. Vigg, this is Gopinath. I have a question. So you are saying probably there could have been COVID-18, 20, but we still refer to as 19. So given this, and also knowing that the viruses mutate, are they like a self-learning, or in other words, intelligent?
Is the virus self-learning or intelligent? Is that your question,
Yes.
Gopinath?
Yes.
Like with every species that God put on this earth, we all have an inherent ability. The vaccine's job is to find a way to harm us, and it's going to figure a way to mutate and try to find a way to, I hate to put it this way, figure a way out to work against remdesivir, work against steroids, work against the antibodies. So it is going to continue to mutate. This is the reason why we have flu season year after year, and this try to stay ahead of the vaccine while the vaccine works to mutate against our bodies. So it's a constant, I hate to put it this way again, but it's a cat and mouse chase that we're going to have to be dealing with. Again, the bottom line is COVID-19 is not going anywhere. We're going to have to learn to live with coronavirus. We're going to have to learn to live in a different way. We're going to have to learn to be vaccinated, get the herd immunity, like we're living with the flu, like we're living with other diseases. COVID-19 is not going to go away. This is the bottom line. And anybody who tells you we're going to get away from coronavirus, they're lying to you. The virus is going to mutate, and we're going to find more and more ways to fight against it. And moving forward, live as a human. So the answer to that is yes, we don't know enough about it yet, but we're still learning as the virus is learning about us.
Last question from Renuka Mishra. She's trying to get on the phone. So Dr. Vigg, last question from Renuka Mishra. I think after that we want to conclude. So Renuka ji, boliye. Renuka ji, connect to your phone. Can you connect to your phone? Well, she called me on my cell phone. She wants to talk about it.
Yeah, okay. Thank you, Dr. Arul. So I join my other senior colleagues in thanking and appreciating your effort in giving us an excellent overview of this COVID-19 and the vaccine. Thank you.
So Renuka ji is not able to reach us. I think we should conclude, Nana ji.
So all questions are done?
Yes,
this is Divya. Could I ask one last question?
Okay.
Dr. Vigg, my question is about fact or fiction. We've been hearing a lot that the vaccine actually has animal DNA in it or animal parts in it from different parts of the world. Could you please clarify which one is a fact or a fiction out of that?
I don't know enough about it. I don't want to lie to you about the animal protein part of it, but I do know it has been tested in animals. So there has to be an animal protein to it. I think this question was brought about by the group regarding vegan people taking it. No, I will have to do some more research on that before I can tell you definitively if there is an animal component to it or no. But I do believe, I'm 99.9% certain there is a animal component to it. But I will send out an email with that information to everybody.
Great, thank you so much.
Just want to add one comment here. I frequently listen to a radio station from Singapore, and in Singapore there are religious groups which are against having this, or in other words, they are suspicious about the same topic, like something preventing them from having this, and the government is taking all the measures to work with those religious groups to make them aware of, it is safe for everyone with the different religious faith to take this. So that is something I wanted to share.
Correct. If you look at the disease and you look at the vaccine, I think somebody had said this, one of the politicians had said this, the cure cannot be worse than the disease.
That's right. All right, no more questions. So I want to thank you again, Dr. Vigg. Good interactive session you have presented today. It's so wonderful, and I will request my president to please conclude this meeting. Nanaji, Sunilji, you have to say something?
Yes, thank you, everyone. Please give a big round of applause to Dr. Vigg. He has done an excellent job. And thank you to all listeners and all people who has questions.
Thank you.
Thank you, Dr. Vigg. We are looking forward to hear you again sometime in near future. Thank you.
Thank you.